Hi, I'm Nick Padlow, the founder of Sophros Recovery, and I'd like to introduce you to our place. Sophros Recovery was started out of my own experience in recovery, where I found that there were residential treatment centers that could help people, but after they got out, there wasn't really another level of care that could provide the services for partial hospitalization and intensive outpatient that would help someone get well for the long run. Here at Sophros, we have 2 group therapy rooms. As you see, this first one is focused on a more relaxed environment where people can have a safe place to feel open and be able to get vulnerable to address some of the difficult questions that they face in recovery. We have 4 therapist offices. This one, as you see, is optimized for virtual treatment. And while we encourage people to come in for the groups, if someone needs to take a session virtually, they're able to do so here. This is our second group room. And part of what we do at Sophros, our treatment program is really split into educational groups, experiential groups, and groups that focus on mind-body. Part of recovery is for us to learn. We have to learn about neuroscience in the brain. We have to learn about what addiction is, what are our triggers, and what are our coping skills. And as we move on through recovery, we're able to dig deeper into some of those experiential questions in groups where we start to identify what are our core and key values, what do we stand for, and how do we communicate and have healthy relationships with others. One of the first things that you will do when you come to Sophros Recovery is have an interaction with one of our nurses here at the front. As you meet our nurse, she'll take you into another room where we're able to talk through some of the challenges that you might be facing. We think about recovery in 4 key components. The first is medical treatment, making sure that all of the things that we need physically are in place. The second, which we talked about earlier, is more of our group therapy and our individual therapy, which is our clinical program. Third is case management, which includes making sure that all the things in life are grounded for us, including our finances, our housing situation, and the things that we deal with, transportation on a day-to-day basis. Lastly, within the 4 components is Alumni Support. We've partnered with MAP Care Solutions to ensure that you have a peer recovery coach after you leave our treatment for the next 12 months so that you have someone to reach out to and work with as you continue to face challenges in early recovery. Our 4 therapist offices are designed to be a place where you can feel comfortable, where you can have individual or family sessions, and where you can meet one-on-one with our therapist, which you'll do at a frequency of at least once a week. This is our clinical director, Erin, and she's designed our clinical program to be one that really meets all of the needs as we think about different priorities in our clinical treatment, whether that's relationships, whether that's trauma, or whether it's developing a set of coping mechanisms for when times get difficult. Thank you for coming on the tour with us today. If you find yourself struggling with substance use or mental health issues, we invite you to call or visit us at sophrosrecovery.com for more information.